Hello and welcome to Career Path Conversations with Spotlight Resumes. I'm Tava and let's kick it off. Okay, welcome everybody. We're here doing another Career Path conversation. I'm here with a friend of mine, Christine, who's a physician assistant, and we're going to talk a little bit about what got you on this path. I know you sort of explored some other career paths first, and you had
Yes.
a non-linear journey to your current role. So
Yeah.
why don't we start just with a little bit more about what is your current role?
So I am a certified physician assistant, which means, and licensed, which means I went through a pretty rigorous 2.5 year program after my bachelor's degree. And right now I work in a residential program for people dealing with substance use. So I manage all of their psychiatric medication. I do some medical interventions as well. And then my flip side job is I'm on the faculty of a physician assistant program. So I have the best of both worlds because I get to be in education and, kind of leading the path for the next wave of PAs, and also get to keep my hands in the trenches in clinical work, which I absolutely love.
So what do you feel like fills your tank the most in your role, or various roles, I should say?
You know, I never imagined myself going into education. I imagined myself a clinician, hands in the dirt, and I never thought I'd go into teaching. And I started teaching students at my job when I worked in a psychiatric unit at Bridgeport Hospital. And we would have students in PA programs rotate with us. It's part of your training is a clinical year rotation. And I don't know, I just fell in love with it, and I kept getting good feedback from the students that they really felt they were learning from me. And so it's kind of like the more feedback I got, the more I grew to love it. And so, you know, in that sense, in my teaching role, I love fostering not just the knowledge, because you can learn anything from a book. What I love to be able to teach is um, how do you really connect with another human being? Your patients a lot of times are in a vulnerable state, and how do you connect with that person? And what I taught this past year, I took on a course called Patient Education and Counseling, and what we talked about is how do you treat the person in front of you? Like, for example, I know how to treat diabetes. But treating diabetes in somebody who's homeless, who might not have a refrigerator to keep their insulin in, who might not have a Sharps container to put their needles in to give themselves the injection, or bus fare to get to their appointments, is very different than treating somebody who has, a stable home and good insurance and can get to their appointments and can get their medication. So I love taking it at that angle and going beyond the textbook knowledge and into the real world, and how do you help this person in front of you right now. And that's where I feel like I'm really starting to find my niche in education. In clinical practice, I honestly look at my job, I'm in a service position. I'm here to serve you. You're hiring me to use my knowledge to help you. And so for me, it's humbling. It really is a humbling job. And it's just like, wow, especially in my field, I'm dealing with addiction. A lot of these clients come from just horrific backgrounds, and just what the struggles they've had, and just the fact that they're from what they've been through, and you're still getting up and you're still fighting and you're still trying to, you know, get into recovery and to get better, and still finding that reason to get out of bed every morning and try again. So for me, that's so it's motivating for me, to be and like honestly honored to be part of that process for somebody. And that's really where I get my passion from.
Yeah, yeah, I can see that it really suits your disposition. To that end, I wonder if you could identify maybe three of the skills or traits that help you with your job the most.
For me, well, for it's clinical knowledge, medical knowledge. You do have to know the basics, and it's not just knowing the facts. It's being able to look at the bigger picture and to be able to pull what's important and synthesize the information you have and come up with a diagnosis or a conclusion, because patients don't read the textbooks, so they don't come in and tell you I'm feeling this and this. They're going to come in, for example, somebody who's coming in for depression. They're not going to come in and say, well, for the past 2 weeks, I've had a low mood and low energy and sleeping too much. They're going to come in and say, I don't feel right. I don't feel like myself. So to be able to have that kind of like detective mentality, and to be able to quickly and accurately pull information from an interview and synthesize it together and be able to say, okay, it's not that, it's not that, it's not that. So being able to, like I said, integrate the information, that the clinical knowledge that you have. That's number one. Number two, you have to have compassion. And it's not just, oh, I feel bad for this person. You really have to be able to put yourself in the position of your patient and really see things from their perspective. And to have a thick skin, because when people are ill, they're scared. But fear doesn't manifest as fear all the time. It'll manifest as anger. It'll manifest as apathy. I don't care anyway, but they're terrified, truthfully. They may get angry at you because you can't fix them, or you can't give them an answer, or you can't give them the answer that they want. And so being able to see past that, almost that mask of emotion, and really understand what's going on underneath. The third one is, for me, it's just that constant, that feeling of wonder, and that feeling of loving the surprises every day. My field can be very heavy, medicine in general and mental health in particular. It can get very heavy. So to not get jaded and complacent, and to still look for the little victories, and just, get these aha moments, and just still have that wonder and that excitement. 20 years later, I haven't lost that. And I'm so grateful for it, because it's so easy to burn out in this field, especially now.
Right. I think that's an important distinction, because the ability to sort of depersonalize and understand what is the root of what someone's feeling enables you to do your job better and not be reactive, which is something, boy, I wish society at large could really get a handle on as well. I think everyone would be a lot kinder. But
Absolutely.
you mentioned something about especially now, and I think it would be maybe a useful segue to just talk about how things have changed as a result of this pandemic, and how you're coping, and what's being done to keep you safe. Anything you want to share about that?
I'm very supported at my job. My main job, which is the rehab, and then I also moonlight in the emergency room in the psychiatric crisis area. I love it, and I love the variety. I have my personal protective equipment. I don't have to get very close to my clients, because, I'm psychiatry, but my physical exam is talking. Once in a while I have to do a blood draw, I have to do a physical exam. Our clients wear masks, we wear masks, our whole place is cleaned down constantly. And my job's very good. I work with a bunch of, marriage and family therapists and clinical social workers. So we're always checking in on each other. We're always making sure that we're doing self-care, and, you're having a rough day, do you need to decompress? Do you need to sit down? So, we make sure that we take care of each other and we support each other. What's really nice is that a lot of practices have instituted telemedicine. And so you don't have to go to the emergency room. You could at least dial into somebody and say, hey, this is what I'm experiencing. Do I need to worry about this? Or, what should I do? So at least, if you're on with a clinician and they say, hey, you know what, that's a warning sign. No, you need to go. That's a nice stepping stone for a lot of people who maybe don't feel ill enough to seek on-site treatment, but at least could use the comfort and the, maybe the reassurance that they're okay, or, what, this is what you need to watch out for.
Right, right. I'm wondering, do you think any of these adaptations will stick around once the pandemic is behind us? Do you think some of this will lead to permanent changes in your field?
I think so. I think we're really, before the pandemic happened, there was transitions into telemedicine anyway. We were starting to see a lot of places start to utilize that as an option for people, especially people who are homebound and can't get to a practice. But I think for a certain population, it's at least, it's a good option, or especially if it's counseling and mental health.
Well, I want to make sure that I just touch on, because I think you have such an interesting story from sort of high school to where you are now. And this is the thing I want to really help demystify for people, especially the recent grads out there who sometimes have this impression that you graduate and you know exactly what you want to do and then you do it. and they feel like they're in the minority by not having that clarity. So if you would just
Oh no.
briefly kind of walk me through the twists and turns that brought you to where you are now. I'd love to hear a little about that.
I certainly took the scenic route. Um, so my original plan when I was 5 years old was to be a veterinarian. And then I developed an allergy to most breeds of dogs in my, like when I was 10 years old. So that went out the window. So my original plan, I finished high school. I went to college. I was a psych major. My original plan was PhD, clinical psychologist. And that was it. And then end of my sophomore year, beginning of my junior year, I discovered art history. And I had this amazing professor, and she was so infectious. I'm like, yes, I want to work in an art gallery. So I took on a second major in art history. And so now I graduate. I'm like, I have a bachelor's in psych, a bachelor's in art history. What do I do? So I had started working in a museum as an intern, and they took me on as a weekend manager when I graduated. So I'm like, okay, nice little weekend job managing an art, managing a museum. And then during the week, I was working as a psychiatric tech. So it's basically almost like a nurse's aide, but with a psych degree. So I did hands-on care and ran therapy groups. But both of those were kind of dead end. I mean, there wasn't a lot of, at least in the psych tech part, there wasn't a lot of growth. I couldn't do much without an advanced degree. So I did that for a few years. And then I thought, okay, this is actually a hysterical story. I said, all right, I'm going to go look into becoming an art gallery curator. And so NYU was having an open house for their gallery curatorship program, their master's in fine arts. So I am horrible with directions, and I do not know my way around New York. I'm from Connecticut. I got on the subway to go to NYU, but I got on the wrong one, and I ended up in the Bronx. So I got off the subway, and I'm sitting on the platform, and this very nice lady came up to me and she goes, "You're in the wrong place, aren't you?" And I'm like, "Very much so." So she told me when the next train was coming. I got back on the subway, went back to Grand Central, and I just went home, and I said, "That's it." So, right. So I was continuing to work, on the psychiatric unit, and I would look at all the medical records. I would look at, the blood tests and the EKGs. I'm like, oh my God, I wonder what this means. And so I started toying, all right, maybe I want to go into medicine. And and at this point, I had no idea what PAs were because it was still a very new profession.
Hmm.
And so I was looking into nursing, and I thought about med school. And I was like, my God, it's going to take me all this time to get my prereqs, take the MCATs, go to med school, do a residency, blah, blah, blah. And so I remember talking to a friend of mine, and I said, I wish there was a profession where I could do a lot of medical stuff, but I don't have to go to medical school. And I could just, like do physical exams and do diagnose ear infections and stuff like that. And he looks at me, he goes, "Oh, you mean a PA?" And I said, "What's that?" And he told me about it. And then it come to find out there was a PA working in the hospital I was working in the emergency room. I left work that morning. I went down to the ER. I found this guy, and I'm like, "Tell me everything." And when he told me, and in fact, he still continues to be a mentor for me now. We're friends 22 years later. And when he told me what the PA profession was, I was like, that's it. That's what I'm doing.
Right. Well, clearly that you have this much passion for it so far in. And it's a lot
Oh, I
like what
love
I
it.
do with clients. We have to identify their personality, skills, values, interests, the types of environments where they can thrive. Do they want stability? Do they want variety? And it really
Mm-hmm.
is, it's a formula and it's different for everyone. And sometimes it leads you down a path and you have to take a hard left. But I don't think people should be discouraged if they haven't found it right out of the gate. So I thank you for sharing that.
Oh,
I
yeah.
think maybe I'll ask one more question since we've
Sure.
got
Whatever.
a crop of graduating people right now. And I have them in mind when I do these conversations. So what would you say
Mm-hmm.
would be the biggest piece of advice that people could do to prepare for a possible career as a PA? Okay.
So, first of all, strong academic background, strong background in the sciences. Make sure you look at the prerequisites of each program, what they require. And oftentimes the bare minimum might get you an interview, but usually that's the bare minimum to be able to get your application looked at. They really look for, very strong students because it's a very grueling program. And the analogy is taking a sip of water out of a fire hose. It's so much information coming at you at once,
Mm.
and it's 2 to 2.5 years year round, nonstop, long hours. It's grueling. Um, the second is shadow. Shadow as many PAs as you can. And also physicians, also nurse practitioners. Be able to understand what the difference is among the professions. We are actually, I believe, according to U.S. World and Report, we are the #3 profession in the country right now. And I think it was #1 for, I think it was #1 or #2 for STEM. So we have huge growth potential. And, you know, we're not going anyplace. So it's definitely a secure job. But it's very competitive. Like I said, the acceptance rate nationally is about 20 to 30%. So there's 200 programs in the country, each take anywhere from 30 to 80 students, as opposed to several more med schools that take about 100 students per class.
I'm so struck by what you said earlier. It could have been one subway ride, could have made the entire difference in terms of your life's trajectory, right?
Absolutely. Yeah.
Well, currently it's a Sunday, it's the middle of the afternoon, and it's a beautiful day. And I assume that you would probably like to spend your day off just relaxing and enjoying yourself before another busy day of work. So I thank you so much for your time on this.
Thank
And
you.
I hope you continue to stay safe and thrive and take excellent care of yourself while there's more demands on you than typical. Yeah, enjoy your day. And I know we'll talk soon.
All right.
All right, take care then.
Thanks for having me. It's a privilege.